Hello friends. Today, we're going to discuss a topic you might not be familiar with, but one that we often encounter without realizing it. Schizotypal personality disorder. What is this disorder? What are its symptoms? Is there a treatment? And if so, what kind of treatment is applied? And most importantly, what are the challenges of living with someone who has this personality disorder? If there's someone like this around you, how can you support them? I will answer all these questions. Also, I will touch on the scientific explanations about why this disorder occurs. If you're ready, let's get started. Schizotypal personality disorder is a condition characterized by distinctive thinking patterns, behaviors, and social interactions. These individuals are often perceived as different or unusual by their surroundings. However, this situation is not their fault or choice. It stems from their unique way of perceiving and interpreting the world. For instance, you might have a neighbor who rarely attends gatherings and often expresses unconventional beliefs. This could be an example of schizotypal personality disorder. Of course, not everyone exhibits such obvious behaviors. However, these individuals generally approach events and people around them with a different perspective. What are the causes of schizotypal personality disorder? The exact cause of this disorder remains unclear, but research indicates that a combination of genetic, biological, and environmental factors plays a significant role. For example, it has been found that individuals with schizotypal personality disorder are more likely to have a family history of serious mental illnesses such as schizophrenia. This indicates that genetic predisposition plays a significant role. Additionally, chemical imbalances and neurological differences in certain areas of the brain can contribute to the development of this disorder. It is also known that negative experiences such as trauma, neglect, or abuse during childhood increase the risk of this disorder. So, both biological and environmental factors can come together to lead to schizotypal personality disorder in an individual. How common is schizotypal personality disorder in society? According to research, schizotypal personality disorder is seen in about 2% of the general population. This means that 2 out of every 100 people might exhibit symptoms of this disorder. Although this percentage might seem small, when we consider the people around these individuals, we are actually talking about a condition that affects a broad group. Additionally, it is known to be slightly more common in men than in women. However, most of these individuals continue their lives without a diagnosis because they are generally not aware of their condition. Symptoms with examples from daily life. To better understand the symptoms of schizotypal personality disorder, let's examine examples from daily life. For instance, let's say you have a coworker who speaks very little during meetings and avoids eye contact. But one day, you go up to them and ask something, and they say, "Do you feel the energy in this room? It's draining me." Or a family member might suddenly say during dinner, "This fork is sending me messages, but I can't decipher them." These kinds of thoughts can be a sign of schizotypal personality disorder. Additionally, these individuals generally prefer to stay away from social activities. For example, you invite a friend to your birthday party and they say, "I'd love to come, but there will be too much energy from people there, it would bother me," and decline. Also, their style of dressing and appearance might be different. For example, think of someone wearing multiple layers of clothing in the middle of summer or wearing very unusual outfits in a formal setting. Such behaviors indicate that they perceive the world differently. Another example could be, a friend constantly tells you, "Be careful with my phone because someone might be listening in." These paranoid thoughts could be part of schizotypal personality disorder. How does the treatment process work? Regarding treatment, yes, schizotypal personality disorder can be treated. However, the treatment process is often lengthy and requires patience. Treatment generally progresses in 2 ways. The first is psychotherapy. Especially cognitive behavioral therapy can help these individuals better understand their thoughts and behaviors. In therapy, the goal is to strengthen the person's connection with reality and improve their social skills. The second method is medication. If the person's symptoms are very intense, antipsychotic or antidepressant medications can be used. These medications help reduce thought disorders and anxiety. But here's an important point: treatment depends on the person's willingness. Because schizotypal individuals often say, "I don't have a problem," and refuse to seek help. In this case, it is very important for their relatives to be patient and supportive. Living with someone with schizotypal personality disorder. So, what is it like to live with someone who has schizotypal personality disorder? Frankly, it is not easy. Living with someone who has this disorder can be challenging and emotionally taxing. Because these individuals generally avoid social relationships, making it difficult to form emotional bonds. Their paranoid thoughts can make them constantly suspicious. Their different ways of thinking and behaving can tire people around them. For example, if your spouse constantly says, "The neighbors are watching me," it can be stressful for both them and you. Or if a partner behaves emotionally distant, it can make the relationship difficult. Another example could be, let's say you are planning a vacation with a friend, and they say, "No, I won't go on vacation because there are hidden cameras in hotels," and refuse. Learning to live with these kinds of thoughts can be very challenging for both them and you. If you are living with someone with schizotypal personality disorder, the most important thing you need to do is to be patient. Try to understand them, don't judge them immediately. Remember that this disorder is not their choice. Be supportive and encourage them to go to therapy. But be careful not to make it feel like an obligation. Additionally, you can try to strengthen their connection with reality. Instead of immediately rejecting their paranoid thoughts, try to provide logical explanations. But remember, it is very important to set your own boundaries. Don't neglect yourself while supporting them. If necessary, seek help from a therapist. Conclusion. In conclusion, living with someone with schizotypal personality disorder can be challenging for both the individuals affected and those around them. But with the right support and treatment, it is possible to cope with this condition. Remember, these individuals need love, understanding, and support just like us. If there is someone like this around you, be patient and understanding towards them. Because we are all different and together, we make up a whole. Thank you for listening. If you have any thoughts about this topic, feel free to share them in the comments. See you in the next video. Take care.